One is interview and the other one is presentation. We'll do presentation first. Now, what is the difference between interview and presentation? So the term itself tells you interview. That means there will be one interviewee and the interviewer. Whereas in presentation, there will be just one presentee, one person presenting it. So for two reasons, interviews can be easier, and similarly for two reasons, presentations can be challenging. One reason is there's just one speaker. So you yourself may recognize this fact that if you have to speak alone on a given topic, your pace will be faster. Yes, you will be speaking at a faster rate because you're not waiting for the other person to respond to it and then think and then again give another viewpoint there. You just have to speak on a given topic. So presentations will have one speaker, and therefore this monologues will be faster in terms of the pace as compared to the interview. Another challenge you have is you will have a total of 6 questions and there will be no pause, right? In listening part C, all 6 questions will come at a stretch. So there will be no pause. Now, in that situation, identifying when the speaker moves from one question to other can be challenging in presentation. In interview, what happens is after each subpoint, the interviewer asks question. So you get to know that now they are going to talk about the next question, which is not clearly, stated in the presentation. There will be just one speaker. So when they move to the next question, that's another challenge. So we are going to learn all those things. How do we understand that the speaker is moving to the next question? How do we cope up with the speed of the speaker? Okay, and what preparation we should do before the audio has started. So let us first look at the extract, the context sentence. So the context sentence tells you that this is a clinical nurse educator, Jennifer, who is giving a presentation. What is the presentation about? Hand hygiene. So the word clinical nurse educator also tells you something, that this is going to be more of the implementation or the clinical aspect of hand hygiene rather than just the theory of it. Okay, and the whole presentation is about hand hygiene. So reading the context sentence gives out the main topic, that they are going to discuss throughout this presentation. So once you have understood the main topic, the next thing you do is you go on to the question and you try and analyze the subtopic, because there will be 6 questions, which means there will be 6 different subtopics which they would talk about. So each question will be on a different subtopic. So what you do in pre-listening time is you try and identify the subtopic of that question, and then you go on to predict what would they talk about in this part of the conversation. And this is the reason why for listening part C you get 90 seconds time before the audio starts. So 90 seconds is almost 1.5 minutes. Okay? And that's fair enough time for you to read the question and predict things. So underlining is not a mechanical process. You actually have to think about the topics being discussed there. So here if you see, it says what surprises what surprises Jennifer about the issue of hand hygiene routines. So this issue word tells you a lot, right? It gives you a clear message that this presentation is not simply about it is not simply about the the hand hygiene or its advantages or disadvantages. This appears to be more related to what are the practical issues probably that we have related to hand hygiene. Right? So this could be probably the subtopic of this question. Now look at the answer choices. Okay. Now this happens to be the first part of her presentation. That means she would definitely go on to give some insight into, what hand hygiene is or why it is important. But your focus is not those things. Remember here also, when you have to identify someone's opinion or attitude, you should be able to differentiate between fact and opinion. So she may give out factual information about hand hygiene, okay? But your focus is not the factual information. Your focus is which area surprises her or what issue about the hand hygiene surprises her. So that's your focus. Now, while you look at the answer choices, you try and identify the keywords from the answer choices. So what are the usual keywords that you look for? Right? The usual keywords are most of the time, if you pay attention to the negative words, they would be keywords. So it's important to highlight negative words from the answer choices. So here you have this word, neglecting them. Okay? Range of conditions that can result from neglecting them. So them here refers to hand hygiene. So is it something that surprises her? Then attitude of many healthcare staff towards them. Now here it is issue. So you definitely know that this is not going to be, if this is the correct answer, definitely the healthcare staff may not have a very positive attitude because this is issue that they are talking about. And variation in policies. So variation has both positive and negative connotation, but when you talk about policies, standards, statistics, results of the study, then variation becomes negative word, right? Because it gives out a message that it was not a standard one. It varies depending on place to place or depending on country to country. So variation is also negative word here. So we have decoded the whole question and the whole all three answer choices as well, and we have got some idea as to what all topics would she describe here. She might initially describe how hand hygiene is helpful in preventing range of conditions, and then she might start talking about what are the issues that we have, and amongst those issues, which one surprises her. So surprises her. Yes. Now, if a person is surprised, you can sense it from their tone. Yes. So one key that I have here is to see where her tone changes when she speaks. And another key I have is the word choices, the vocabulary that she chooses, right? That would indicate surprises or that she's surprised about it. Similarly, let us look at the second question. The second question is about it says Jennifer mentions recent data on infection levels to support her point that. So this is typically purpose question. Okay, it is already given that she is going to talk about some data that she has on infection level. Now you have to find out what point is she trying to prove with the help of this data? Let me give you one example. Okay? For example, if I start saying that malaria is one of the most common infectious diseases in developing countries, causing or being, or you can also say, responsible for many deaths. And then I go on to say that in sub-Saharan Africa, okay, 10,000 people die due to malaria in the period of 6 months. So here I'm giving out the statistics of sub-Saharan Africa. But what point am I trying to prove is not just about sub-Saharan Africa. My point is the death rate in developing countries. So whenever you have a purpose question, you don't go for the data for which or the data that are given. You go for why those data are used, or what is the purpose of using those data, what point is the speaker trying to prove. So here also it is in a similar way. Why is she using the data? But what point is she trying to prove? Again, you go for negative words. So if you look at option A, it says there appears to be complacency within the health sector. Any idea what does this word complacency mean? Have you heard the word complacent, complacency? What does it mean? What does the word complacency mean? Any idea? Uh, yeah, complacency means self-satisfaction. You are kind of, okay with how the situation is, and you don't feel the need to change the situation. Kind of, in Hindi, we refer to it as chalta hai attitude. Like you're not, seeing any need to change things and you're not willing to change things. So in that terms, complacency is a negative word. Okay, it's kind of negative attitude that the health sector has towards it. Now here again, the main topic is hand hygiene. Okay, so when she talks about infection level, definitely it is not a separate point. She is going to establish the connection between hand hygiene and infection levels, right? And then what point is she trying to prove? Maybe she may go on to talk about how not following hand hygiene can be, causing infections, and it is data. So she may give you, number of people getting affected due to infectious diseases. And then what point is she trying to support with that? Then look at the second one. There seems to be falling standards. So falling standards is also a negative word amongst healthcare staff. So see, falling standards is first point. Complacency is beyond that. Next step, that Definitely the standards are falling, but at the same time, the healthcare professionals or the healthcare sector doesn't seem to be concerned about it at all. And third one is an increase in the number of patients. So basically increase in the infection levels. So when can I use an increase term is if the data is comparative. If there is a comparison that in 2016 this many people were affected, but in 2017 this many people have been affected. So only if there is comparative uh, description, then C would be the correct answer. If the data is about how every year this many people are getting affected, then probably C would not be the correct answer. Right? So now I know after decoding this question that in this part of the conversation, they are going to talk about the recent infection levels and what point is she trying to prove? Is she trying to say the infection has increased? Is she trying to prove that infection has increased because the standards have fallen? Or is she trying to prove that infections have increased but healthcare professionals don't seem to be bothered about? Right? So what I'm going to do next is I'm going to play the audio for this one, for these two questions. You will be listening to this audio and you'll answer these questions. Please make sure that your answers are sent privately so that other students are not getting distracted by your answers. Okay? So I'm going to have this audio and at the same time, I'll be sharing the screen as well.
I'm a clinical nurse educator and I'm here today to talk about something very familiar to us all. It's a routine that can potentially save numerous lives and one that we've all been taught since we were toddlers: hand hygiene. This is described by many healthcare workers as possibly the single most important tool in preventing the development of healthcare-associated infections between patients. Infections such as Staphylococcus aureus, Clostridium difficile, MRSA, and gram-negative bacteria. Most hospitals have strict policies and guidelines that we must all abide by. So if it's so important, why do we continue to see such an underutilisation of such a basic practice? Why don't we follow the procedures that should already be ingrained? This, unfortunately, has proven difficult to determine. Let's first put things into perspective with new data from the Centers for Disease Control and Prevention in the USA, which found that 1 in 25 patients acquires a healthcare-associated infection during their hospital care. Now, for whatever reason, this figure doesn't tend to set off any real alarm bells in people. But that adds up to about 700,000 infections a year. A little more alarming. The clincher, however, is of those, 75,000 patients die from their infections. That's an incredible number, and one that should shock anyone hearing it, because it's a number that quite often reflects human neglect and forgetfulness. One may even suggest at times laziness. Stopping the spread of infection by way of hand hygiene.
So here, the word recent data help you to move on to the next question, right? Within the question, there will be a keyword that would help you to move on to the next question. So, were you all able to answer both the questions? Please send in your answers. Okay, so I can see that almost everyone has gone for B in the first one. So that is true, it is correct, because she clearly mentioned that if it is so important, why do we see such an underutilization of such a basic practice, right? And although she did talk about various infections that can be prevented, that was mainly used to highlight how I'll just bring on script to help you understand. It was described as fact that it helps in preventing so many infections. And she clearly said that most hospitals have strict policies, so this helps me to rule out C. There are no variations. The policies are in fact strict, but still we see underutilization. So this was fact. And here you can see this unfortunately has proven difficult to determine. So opinions usually would come with adjectives and adverbs as we studied in the reading part C. Similarly, here also it applies. The opinions will be described with adjectives and adverbs that would help you to differentiate this is fact and this is opinion. Right? So the correct answer for that happens to be B, the attitude of healthcare professionals towards them. And I can see that for second one, a lot of you have selected C, but that is not the correct answer for two reasons. One is because I mentioned an increase in the number of patients. So when I say an increase, that means it has to be a yearly data. If we had the data of some previous years, and if we had the data of current years, and she did talk about so many infections happening. There was the numbers that were shared, but those numbers were not shared just to prove that so many infections occurred. What point she was trying to make here is, see, the listening part C is more about understanding the speaker's kind of inferential meaning, kind of understanding, what they are thinking at the moment when they are speaking this, picking up the hidden meaning of what they're trying to convey. So they did use the data. She did say that 700,000 infections happen a year. So that was every year. There was no comparison of how previously they were less and now they are more infections. If that was there, then you could have said an increase in number. Here she was giving data of every year. And then it is alarming, but still this figure doesn't tend to set off any alarm bells in people. So she was using this data, she was saying that even if there are so many infections, still we are not alarmed about it. And again, when she talked about the death, she said, that's an incredible number, and that should shock anyone hearing it because it is a number that reflects human neglect and forgetfulness. So this also tells you that she is giving out this number to show how human neglect and forgetfulness is resulting in so many infections and deaths. So the purpose why she was using this is trying to show that how healthcare professionals are negligent towards these numbers. So complacency, A, is the correct answer here. There appears to be complacency within the health sector. So C is ruled out for two reasons. An increase. If it was about increase, then there should be comparison. There is no comparison. Simply the data of each year is given. Two, the purpose why she was mentioning this data is not just to show that so many people are getting affected. She was trying to prove that even if so many people are getting affected, still it is not alarming the health sector. Okay? And this data reflects human neglect and forgetfulness. So the point she was trying to make is complacency within the health sector. Forgetfulness and human neglect may also, drag us towards this falling standards among healthcare staff. But then she went beyond it. She said that even though we have so many infections, it doesn't set any alarm bell. That means the healthcare sector is still not, paying attention to this in spite of having so many infections, right? So this is the main challenge in listening part C, where you can't straight away go by one answer choice because you heard something about it. You are going to hear something about each option. There will be something about all three options there. But you have to actually identify why all those things are being said. What is the ultimate point that they are trying to make? Again, the good summary of that 1 minute conversation, or maybe 50 to 55 minutes, 50 to 55 seconds conversation. So let us do more practice for this using the same strategy for next two questions. Again, here we'll have to keep in mind the keyword from the question that would help us to move on to the next question. So Jennifer suggests that the concept that hand hygiene can prevent infections suggests, that means her opinion about this concept that hand hygiene can prevent infections. So I have to hear about her opinion on this. Again, we would underline the negative words from the answer choice. Has been weakened. So weakened is a negative word. Why? Due to new technology. So here she would be discussing probably when we saw in the beginning that people are not following the hand hygiene as much as it should be. So here maybe she would go on to discuss the reasons. So if she blames technology for it, then A could be the correct answer. Then has long been accepted as essential to good healthcare practice. So is she trying to give out history? It has long been accepted. Has long been means it is there for years and years or decades. It's not something new. So if she goes on to give out history about how hand hygiene evolved and how it is there for so many years, then this could be the correct answer. And more readily acknowledged. So here there is a comparison of how important the hand hygiene is for some branches and not for others. So if she goes on to give any comparison as to how certain branches follow hand hygiene really well and the others don't, then C could be the correct answer. Then next one, Jennifer feels. So again, her opinion that hand hygiene is particularly valuable because. So here I have to listen for the reasons why she thinks it is helpful. So here she might talk about the benefits of hand hygiene, right? And what is the particular benefit of it? So it can be easily embedded in an individual's behavior, easily. So I tend to go for negative and extreme words. So sometimes if there is no negative word, then kind of extreme words like easily, right? Is telling us that yeah, it's something that can be done easily. Then provides protection from the most commonly found organisms. And it is uncomplicated and cheaper with a very little cost. So what reason is she particularly trying to highlight about the benefits of hand hygiene? Now, here it says most commonly found organisms. I would like to ask all of you a question. What is the difference between many and most? Are these two different terms or are they both the same? Many and most. Are they both the same term? No idea. So, for example, if there is an institution which has, the total number of students that are 10,000. So, out of 10,000, if there is an event and if 100 people attend that event, so I can still say many, isn't it? 100 is many. But can I say most student attended? No, because many just indicates numbers, whereas most is proportionate. So depending on how much you have total, out of that you can say most. So out of 10,000, if 7,000 attend, then I can say most. But even if 100 attend, which is hardly 1% of the total number, I can still say many students. So that's the difference between many and most. Okay. So here it says most commonly found organisms. So if there are many organisms, it may happen that it may be many organisms, but they are not the most commonly found ones. So if she says most commonly found organisms, then or something similar to that, majority of them, or then similar kind of words she uses, then probably this is the correct answer. And this is uncomplicated and little cost. So now I'll play for these two questions and then we'll move on to the discussion of this.
Hygiene is hardly a new concept. Its importance was first brought to life in the mid-19th century when it was found that physicians who washed their hands before delivering babies prevented deaths in postpartum women. Such an idea was initially ridiculed, as most new theories are. But even now, after centuries of knowledge, it seems to me we're still, in many ways, ridiculing it by simply overlooking this basic practice. In stopping the spread of infection, Even the most advanced healthcare is of little use if the basic principles of hand hygiene are neglected. We have valuable technologies and intricate tools at our disposal to prevent hospital-acquired infections, and yet such advancements can so easily be made redundant if healthcare workers don't toe the line and simply neglect to wash their hands. That doesn't sound like genuine advancement to me. One of the most valuable things about hand hygiene is that it works for so many different types of organisms, and you get a lot of bang for the buck, so to speak. Such great protection from so many nasty things by such a simple and inexpensive action that any person can do with ease. The issue is that you have to practice it at a high level of compliance for it to work. Within a hospital setting, there are so many opportunities for hand hygiene, and it's difficult to get a level of compliance where we're able to make changes to infection rates. What we need to do to combat this is to turn hand washing into what many people already suppose it is, an instinctive ritual. So how do we monitor?
Type in your answers. How about other students? Could you not attempt? Could you not select the answer choice? Did you lose the connection with, or did you just, lose your concentration? Okay, so I can see a lot of you have got confused in C here. A lot of you have chosen C as the correct answer. But was there any comparison? Let me bring in the transcript. There was no comparison as such. She just used one sentence where she said that some physicians who washed their hands could reduce the deaths in postpartum women. But that was something she was explaining about mid 19th century. And then she did not say that however the other areas neglected it. No, right from the beginning she said that it was neglected, okay, but it is acknowledged. We knew that it is helpful, yes, because here she said that it is hardly a new concept. So it is not a new concept, and its importance was brought to attention even in the mid 19th century. And then technology, that was also quite catchy option. So she did talk about technology, but she did not blame technology to be the responsible factor for reduction in the hand hygiene principles, because she was in fact saying that even if you have the valuable technology, it is of no use. Okay, even the most advanced healthcare is of little use. So this is quite common. You will see that listening part C, the negatives would not straight away come as negative. Okay, they might use words like seldom, little, hardly. So all these words also mean no or almost no. So it is not a new concept. It is of no use. So if they straight away give you the no, then it becomes quite, biased. So instead of that, they would use hardly, seldom, rarely, little, few. But that also means a very small proportion, or that goes into extreme negative. Okay. So C is not the correct answer because there is no comparison that there are some branches who accept it and the other branches don't. No, that's not the correct answer. In fact, correct answer here is how right from the beginning we know it. How it is known right from the beginning. So B is the correct answer. Has long been acknowledged. We know about the importance of it since long. It's not a new concept. So B is the correct answer for 39. And for 40, yeah, a lot of you could get correct answer for 40, which is C, but some of you have also gone with B, most commonly found organisms. Again, here, as I discussed, she explained that many organisms, not most commonly ones. She said that basically the point that she was trying to highlight is you get a lot of bang for the buck. So that was about the cost. Okay, and it provides great protection from so many nasty things, and it is such a simple and inexpensive. So simple and inexpensive tells you with a very little cost and uncomplicated. And then she did talk about, different types of organisms, but again, so many. So it does not necessarily mean that many would include most commonly found organisms. So she did not talk about what are the common infections at all. She simply told many organisms. So that helps me to rule out B. And she clearly said that this is difficult to get into the practice. That level of compliance within a hospital setting, there are so many opportunities, but it is difficult to get to a level of compliance. So it cannot be easily embedded. We need to embed, she said that we need to make it an instinctive ritual, but it is not that easy. It's going to be difficult to reach to that level of compliance. So correct answer there is C, uncomplicated, and it comes at a very little cost. So here you can't simply go with just one or two words. Like this was very common, commonly found organisms. She said many organisms, but you can't just go with one word. Again, she did talk about habitual behavior, but not easily. She said it is difficult to get that level of compliance. Okay. Now, next two questions. So here she says, what problem does Jennifer identify with the direct observation as a method of monitoring hand hygiene? So now you know that in the previous, this is entirely one single presentation. So it is interlinked. So the previous part of the conversation, she highlighted that, it's really difficult to get that level of compliance. So if you wanted to see how much is the compliance, if you wanted to monitor, how would you monitor? Compliance means, how strictly or how sincerely people are following your advice. So here it is about the compliance of healthcare professionals, because hand hygiene, when it comes to its practical usage, it is about how healthcare professionals are, or how sincerely the healthcare professionals are following hand hygiene. Now, if you wanted to monitor, okay, one way is to monitor through direct observation. Go into the wards and see if people are washing hands or not. So we can expect that in this part of the conversation, she is going to explain what is the problem. So maybe she would here explain an experiment or a study that they did, okay, where direct observation was used as a method to monitor hand hygiene, and then she may explain what problem did they face if they used direct observation, which means one person was there in the wards and who was directly observing the staff if they were washing their hands or not. So this is what I have to do, prediction from the question. So what are the answer choices? Observers, so the one who are observing the compliance, can make subjective judgments. That means they are biased. Their judgments are biased. Then presence of observer can influence staff behavior. So observers are not biased, but staff's behavior is getting affected because of observers. And we know this happens very commonly. And observers may not always provide a good model. So what is the problem? Is it the observer that is the problem? Then you can have either A or B. If the observers make biased judgment, then A. If they don't provide good model, C. But if observers are not the problem, but the staff's behavior changes because of observers, then it could be B. Look at the next question. Jennifer mentions car seat belts. To underline means to highlight her point that. So this is also a purpose question. Because her main topic here is hand hygiene, but she is using the example of car seat belt. And you have to find out what point is she trying to make while she compares car seat belts with the hand hygiene. So should it become an automatic action? Like for example, wearing a car seat belt is an automatic action, right? We don't do it purposefully. It's so strongly embedded in your subconscious mind. Then instinctive response. So instinctive response also means automatic action, but only to a personal danger. So doing it only when there is a personal danger. For example, when you take away your hand from the flame, or as soon as you sense something, which is hot. So that is the typical example of instinctive response to personal danger, and needs to be a conscious decision. So you see the difference between A and C. A is it should be subconscious, automatic action. C, conscious decision. Whereas B, only when there is personal danger. So this kind of analysis you will have to do. In the beginning, it may take you some time to predict, okay? But as you practice more tests, or as you listen to more podcasts on YouTube or on different health-related websites, this prediction skill would improve for sure. So now I'm going to play the conversation for these two questions. Listen to it carefully and go for the answer choice that best summarizes the whole 1 minute conversation. Okay, here you go.
To people in a healthcare setting without hovering and interfering. The gold standard in monitoring hand hygiene compliance is direct observation. But the reliability of this method to measure true, actual compliance is questionable. This is because it increases dramatically when observers, who are usually well known to the staff, are circulating in the unit. The rates then decline almost immediately once they've gone. Furthermore, being a known staff member also influences this. I'll give you an example. In one study, we hired a student for hand hygiene observation in the same unit as a well-known staff member. We found that the staff member observed close to 70% compliance and the student observed close to 30%. The bottom line is that there's a big discrepancy there. The main problem associated with a lack of hand hygiene compliance, I believe, is that humans are not, in fact, naturally hardwired to perform hand hygiene in the absence of sensing a substance on their hands. If compared with the use of seatbelts, for example, most people don't even think about putting the seatbelt on when they get into a car. They do it on a subconscious level, and they're usually not even aware they put it on. That's where we need to be with hand hygiene, hardwired so that we do it without even thinking about it. When a behaviour is hardwired like that, you can always sense when you didn't do it because you start to feel uncomfortable. It's a long process, however, to get to that end point.
Type in your responses. Okay, so yeah, it's true that in 41, two answer choices are quite tricky. This is clear that they don't make biased judgment, but whether they don't provide a good model or whether they can influence. So here, uh, what was mentioned is that they tried two ways of direct observation. They, in one case, they had a known staff member, and in the other case, they had a student. So the compliance level varied. It was 70% for the known staff member and 30% for the student. So this doesn't prove that direct observation is not a good option, but it could be a problem, particularly when the well-known staff member becomes a direct observer. So B is the correct answer here. How the presence of staff member or how the presence of observer can affect staff behavior. Now, obviously, these are inferential questions, so they would not straight away say presence of known observer. Right? If I say may not always provide a good model of compliance, which means this is not at all an option. So it is an option provided that the observer that you have is not a known one. So B is the correct answer here. It was influencing the staff behavior because when the known member was there, probably people knew that they were being observed, so they could see 70% compliance. But when people knew that they were not being observed, then the compliance went down to 30%. So that's too low a compliance. So it was influenced by the presence of observers. In students' case, staff didn't knew that they are being observed. Okay, and for the question number 42, yeah, so 42 is A. It has to become an automatic action, right? There were two keywords that helped you. In fact, there were many, but two particularly, two phrases can help you quickly pick up the answer. One is when she said that we are not hardwired. So to be hardwired means it is something that it is so strongly embedded in your subconscious mind. So that is to be hardwired. And then she said that they do it on a subconscious level. And the same thing needs to happen about hand hygiene also, she said. So it has to become an automatic action. A is the correct answer. Right? So this happens to be the most challenging part of listening. And in the beginning, you may struggle with it because The accent, not being familiar with the accent could be one reason. Two, even if you are understanding everything, but when you are listening to it, summarizing it could be difficult. While reading, you can read it again and summarize, but when you have to listen to it, it could be difficult. So with pre-listening and with more exposure to this kind of language could help you, right? So instead of next time, instead of binging on next Netflix, try to binge on this. You can go on to YouTube and type podcast. I would particularly suggest podcast uh, for of Dr. Norman Swan. He's the best because the accent helps you, and then all the podcasts that he has include a lot of statistics and research, so this could be really helpful. And you can also go on to Medscape and subscribe for their weekly podcast or articles. So that can also be helpful way of getting more practice for reading and listening.